The following is a paid commercial program. Views expressed belong to its participants and are not necessarily those of the management and staff of WRAL or Capital Broadcasting Company.
It's time for answers to your medical questions. And get an inside look at the latest in healthcare, medical technology, and treatments. This is Rex on Call.
We have truly entered the future.
Robotic surgery sounds like the stuff of science fiction, but it's very much the reality at Rex Hospital. Welcome to Rex on Call Live on WRAL. I'm Kim Dean Holderness for Rex Healthcare. Rex is one of the busiest hospitals in the Southeast for robotic surgeries. More and more physicians can use this robotic technology to offer less invasive surgical options to patients. If you have questions concerning the surgical treatment of women's cancers or urologic surgery, give us a call. Your questions may be answered here live on our program by our experts. Just dial the number on your screen. There it is right there, 919-744-3876. Outside of Wake County, give us a call toll-free, 877-277-6252. Today's experts answering your questions on robotic surgery are Dr. Jack Inge with Mid-Carolina Obstetrics and Gynecology. He was the first surgeon to perform a robotic hysterectomy at Rex in 2008. And Dr. Mark Jelcut with Wake Urological Associates. Dr. Jelcut is one of the most experienced robotic urologic surgeons in the area, specializing in prostate cancer, kidney cancer, and reconstructive surgeries. To connect with us here at Rex on Call, just dial that number on your screen. Once again, Wake County, 919-744-3876. Outside of Wake County, 877-277-6252. And if you're watching us stream live on WRAL.com, you can even email us at rexoncall@rexhealth.com. Also, long list here. You can find us on Twitter. You can send us a message at Rex Healthcare, #RexOnCall. Now, as you're thinking about your questions, we want to introduce you to UNC's Dr. John Boggess. He's been a leader in using robotic surgical technologies to treat gynecological issues, and he's a regular at Rex Hospital. He says some women have been putting off needed surgery for fear of a long, painful recovery. Well, there's no need anymore. Take a listen.
UNC's Dr. John Boggess is credited with pioneering a lot of the procedures using robotic technologies in treating gynecological cancers. And he's making weekly trips to Raleigh to treat patients at Rex Hospital.
The advantage is to help women in Raleigh stay in Raleigh and get treated at Rex, the hospital they're familiar with, but provide the care that we typically provide at UNC Hospital.
And by using the latest in robotic technologies, Dr. Boggess can perform delicate procedures through tiny openings where surgeons once had to make large incisions.
What it means is that I can take care of a woman with uterine cancer or a complex GYN problem with the robot, and with a rare exception be able to send her home the next day.
Dr. Boggess has taught thousands of surgeons in more than 20 countries how to use Da Vinci robotic technologies to perform gynecologic procedures. In fact, within 5 years of first introducing this technology to his specialty, it's estimated that 65% of women's cancers in the U.S. are treated with the robot. But know this, it's not the robot doing your surgery.
The robot is a misnomer. It's not actually a robot. It doesn't think for itself. It doesn't do anything autonomously. Your surgeon is the one controlling the instruments. The outcome you experience is because of your surgeon's ability. A patient has to be careful. They don't just want the robot. They still want a qualified physician who knows what treatment's appropriate for them and who can do a good surgery and a good operation.
And joining us now is Dr. Mark Jelcut and Dr. Jack Inge. So talk to us, in each of your specialties, what are the type of surgeries you can do using this robotic technology? We'll start with you, Dr. Inge.
So for gynecology, it's used for hysterectomies, myomectomies when you just want to take the fibroid out of the uterus and preserve fertility, and also for endometriosis surgery. A lot of women have chronic pelvic pain, and this is a great modality to treat that.
And so that's your most frequent use?
Yes.
Okay. What about you?
In urology, the most common surgery is for prostate cancer. We also will operate on the kidney for kidney cancer or for cancer of the ureter, either removing the whole kidney or more commonly now removing just a portion of the kidney, something called a partial nephrectomy. It's also used for a radical cystectomy when someone has advanced bladder cancer. And in addition, there are some reconstructive applications. If somebody has a kidney that they were born with that does not drain well, then we can take it apart and put it back together to help with that. Or if they have disease of the ureter, a stricture, obstruction from stones, et cetera, we can fix that.
Okay, now we are getting some questions in, so let's get started. This is from Amanda and Carrie. She recently found out she has a 4-inch uterine fibroid in the center of her uterus, and she's interested in having kids as soon as possible. She has an appointment with a surgeon who is suggesting a laparoscopic technique, but also a surgeon that uses the robotic arm at Rex. What's the difference in the two procedures?
Well, we've had laparoscopic surgery since the 1980s, but even with laparoscopic surgery in 2005, 60% of patients were still getting big incisions, what we call exploratory laparotomy, where you make a large C-section type scar. With the advent of the robot, essentially my opening rate is 0% for the last 3 years. So I think it's a minimally invasive surgery that allows you to complete the surgery a lot more often than if you did it with a laparoscope. Probably 10 or 15% of laparoscopes now have to be open because the surgery is too complicated to do it with a laparoscope.
Okay, and Amanda wanted to know, so the best chances for future fertility and pregnancy, is there a difference between the two procedures?
No, there's a greater chance that they wouldn't be able to complete it with the laparoscope, and then she'd have a longer recovery, a 6-week recovery instead of a 1 to 2 week recovery.
Okay, and she wanted to know, how does she find the most qualified surgeon? What are some things you suggest patients look for?
Well, as Dr. Boggs alluded to earlier, I think finding a qualified surgeon with experience would be the best thing to do. At Rex, for instance, we've had surgeons come from all over the Middle Eastern states for the last 2 or 3 years to watch us do surgery and to learn, and now we've been designated as an epicenter so people can come from nationwide to watch us do surgery.
So that's a pretty good education there. So Dr. Talcott, are there situations where a robotic surgery would not be ideal?
Almost never.
Okay.
Very, very rarely would we not be able to successfully complete a robotic surgery. Usually that's in a patient who is obese and extremely obese, and that's usually because of anesthesia issues. Sometimes surgeons who are relatively novices at robotic surgery will shy away from patients who have had significant prior surgery, but in my experience that hasn't been a problem.
Now, what happens if you do need to open up a patient midway? You said you haven't had that situation happen, but I mean, I'm assuming it can.
Yeah, probably 10 or 50% of the time with a laparoscope you have to open a patient, then you would just abandon the case and do a C-section type scar. But for the last 3 years we haven't had to open any patients with the robot.
Okay. Are there any, I mean, we got another question in, is what happens if there's a power failure?
The robot has a battery backup, as does the hospital has its own generator. So if the city lost power, the hospital still has power. But the actually robot has a battery backup, so you have time to safely disengage, if you will, and then do what you have to do to get the patient safe. But there are enough redundancies that really shouldn't be a problem.
And I know we're going to get questions in terms of the cost, because to me, robotic technology, it seems like that's going to be a pretty pricey, endeavor as a patient. But you say no. This is actually, there's benefits, financial benefits for the patient, right?
Actually, it's not any more expensive to the patient, but they have a greater chance of having it successfully completed. And you got to count, they're able to go back to work in a week. I have a lot of patients operate on Monday or Tuesday, and they go back the following week to work instead of going back to work 6 weeks later, so they're a lot more productive. So in that sense, it's actually cheaper.
Yeah, the way that it works is the hospital bill that a patient gets is the same whether the surgery is done robotically, laparoscopically, or open. So there's no difference from the patient from a billing standpoint. The hospital has made this investment in the technology because it has other rewards. That patient has less pain, fewer complications, fewer need for blood transfusions. They're out of the hospital faster. And so the hospital thinks, obviously, hopefully it's worth that investment for that better outcome. For the patient, though, the real outcomes are at home. They're home very quickly. They have very little pain, faster convalescence. They're back to work much faster. And then there are, in urology, there are then some very specific outcomes with respect to urinary function, sexual function, lack of other complications, which are hopefully improved.
Well, great. Well, those phones are ringing, and we're going to be back after the break to answer some of those questions. Just give us a call using the numbers at the bottom of your screen, or you can send us an email, rexoncall@rexhealth.com. You can tweet us a question, Rex Healthcare, at Rex Healthcare, hashtag RexOnCall.
Charis Yarborough, or Mo as she likes to be called, plays club volleyball at NC State. Earlier this year, when nationals were fast approaching, she was sidelined with serious pain.
At first I just thought it was, something with like a stomach bug or like food poisoning.
Welcome back. This is Rex on Call Live on WRAL. Today we're answering your questions on robotic surgery. If you have questions for our experts, call us now. In Wake County, call 744-3876. Outside of Wake County, 877-277-6252. And without question, Rex is a leader in this robotic surgical technology. Now, surgeons from all over the country will be making the trip to Raleigh because Rex has been named an epicenter for the Da Vinci surgical system. Also, they can learn techniques to treat patients like Charis Yarborough. Take a look.
Charis Yarborough, or Mo as she likes to be called, plays club volleyball at NC State. Earlier this year, when nationals were fast approaching, she was sidelined with serious pain.
At first I just thought it was, something with like a stomach bug or like food poisoning or something along those lines.
But her symptoms only got worse.
It got so out of control one night about 2 a.m. I had one of my friends come pick me up and we went to the emergency room.
They discovered a softball-sized benign ovarian cyst, and she needed surgery. And she knew she wanted to be treated at the place that's teaching surgeons how to use the latest technologies. Rex has been named an Intuitive Surgical GYN Epicenter, an elite designation with only 21 in the country.
Which means that people from all over the country will come and watch us do surgery and learn how to do robot surgery with us. It's kind of a center of excellence. It's a huge honor to be chosen, and we're the only one in North Carolina.
Dr. Jack Enge and other Rex surgeons have performed more than 2,000 robotic surgeries since the technology came available in 2008. The newest generation of the robot has a wide range of gynecological, urological, and general surgery procedures.
I think it's amazing that we have a robot that can do this kind of surgery where you don't have to make an abdominal incision, but there's so many people who don't know about it.
But patients like Mo are helping spread the word.
I talked to some of the people at home and we talked about how, they used robotics equipment, and they'd be like, you had a robot perform surgery on you? I'm like, it's not quite like that.
Her tiny incisions meant she was practically pain-free for the first time in months, the very next day.
By that morning, I had very little soreness to be at all. It was so astonishing to how quickly I recovered.
She felt so good, in fact, she was back practicing with her team within a week.
Being in so much pain for such a long time is very trying on your emotions, on you physically, because you don't know what's wrong with you, and just being able to feel better and have no soreness and be able to recover so quickly was just so uplifting.
Okay, let's get to some questions real quick. This is from Linda and Raleigh. Will insurance cover a robotic surgery? Medicare, those sort of questions. We just talked about the financial benefits, but yes, you're saying insurance covers it.
Yeah, there's no problem with insurance coverage.
And can robotic surgery be done on a total knee replacement? We're not there yet
No.
in terms of robotic surgery? Maybe one day. Okay, Josephine from Rocky Mount, a fibroid tumor. Can you remove that without having to do a whole hysterectomy?
We can. For somebody who's young and wants to preserve their fertility, we can go in and just take the fibroids out. I've had a patient where we removed 13 fibroids robotically.
Wow.
And 8 months later, was pregnant.
Okay, that's great news. Okay, this is from Carl, an inguinal hernia. Is that something that can be used with robotics, treated with robotics?
Inguinal hernia surgery is done by general surgeons. They currently do those surgeries either open or laparoscopic. There are probably some general surgeons who do it robotically as opposed to laparoscopic, but that's sort of a new area where the robot is getting into. If you have an inguinal hernia, just go ahead and see your general surgeon for further information.
Yeah, and so, but you were saying there are going to be additional applications in the future. Yeah. Patsy from Roanoke Rapids, is the robotic surgery suitable for spinal problems, nerve damage? Not at this point?
No, not at this point.
But we're getting there, we're getting there. Okay, this is from Jill and Raleigh. Okay.
So she has adenomyosis, which is
Okay.
a form of endometriosis that occurs in the muscle of the uterus. They did a really nice study where they took a laparoscope and put it in a patient with endometriosis, and they saw 3 lesions. Then they took the camera out and put in the robotic camera, which has high definition, 3D vision, 10 times magnification, and they saw 18 lesions in the same patient. So with the robotic cameras, we can see more lesions, and then when we see them, we can actually do more to treat them. We can actually excise the lesion and then sew the defect up.
So talk to me, though, about your field of vision versus opening a patient entirely. Would you see more by opening a patient or with those robotic techniques with the 3D cameras?
With the 3D camera and high definition, I can actually see better with the camera than in my own eyes.
Okay.
It's really, truly amazing.
You don't have peripheral vision, so you have to know what you're looking at or towards. But having said that, the visualization is remarkable compared to open. When we do prostate cancer surgery, the prostate's tucked down within the tight pelvis underneath the pubic bone, and it's like trying to operate in the back of a desk drawer that's stuck and you can't open it all the way. Whereas with the robot, we can take this great camera that provides three-dimensional image, high def, so you've got depth perception and magnification, and we can put it right on what we're looking at. So you're looking at things better than ever before. When we first started doing robotic prostate cancer surgery, they actually went back and renamed some of the anatomy because we were actually seeing it correctly for the first time.
You're kidding me. That's so fascinating. This question is from Carrie. Is this surgery used for a prolapsed bladder?
So traditionally, if a woman has just a prolapsed bladder, then she'll have a vaginal surgery to correct that. Is what was colloquially was called a bladder tack. Often, however, women have not just a prolapse of the bladder, but also perhaps of the uterus, or where if a woman has had a hysterectomy, what's called the cuff, or maybe even the rectum as well. And for those more complicated cases, there is a procedure called a robotic sacrocolpopexy. I know it's a mouthful, but it's probably the most durable, best sort of anatomic repair that can be done. It used to be done as a fairly morbid open surgery, and now that surgery is only done robotically, and that's really been remarkable.
Okay, good to know. Coming up, we'll answer some more of your questions in Wake County. Call that number on your screen, 919-744-3876. Outside of Wake County, that number's there for you too, the 877-277-6252. We'll be right back. Welcome back to Rex on Call. We're answering your questions on robotic surgery. We're going to get to these questions right now. The phones are really busy now. This is Robert in Fayetteville. Prostate and colon cancer, internal and external hemorrhoids, and now diagnosed with rectal cancer. Can robotic surgery be used in an attempt to remove some of these cancers?
So that's really complicated. Certainly prostate cancer can in the right patient. General surgeons are doing laparoscopic colorectal surgery, and they're starting to do robotic as well. That's a very complicated question. That patient should really just follow up with his local physicians or give somebody up here a call.
Okay. This is Judy in Sanford. Is the surgery used for cancer of the thyroid? Are we there yet?
We're not there in our community.
Yeah, okay. Margaret from Nashville, North Carolina. Robotic surgery done to remove scar tissue above the abdomen?
Some people have adhesions and scar tissue from either previous surgeries or infections, and you can use a robot to remove those adhesions and clean everything up.
Okay, this is Joe from Sanford. He has Crohn's disease and it's affected the bladder. Can you still use the robot on somebody who has Crohn's disease?
Sure, you can for the prostate. For the surgeries that we do, Crohn's is not usually a contraindication.
Okay, this is Joyce from Wendell. She's had her bladder drops and she needs her bladder tacked, and they told her her doctor said not to do the surgery due to Plavix that she's on. Is that true?
So there are a lot of patients today who are on blood thinners, aspirin, Coumadin, Plavix, and there may be contraindications to being able to stop those. However, in the modern world that we live in, we just do surgery when patients are on those medications. There's a higher risk of bleeding, but we just do the best we can.
Okay, great. Okay, we'll have a final round of questions after this break. This is Rex on Call. Welcome back to the show. This is Rex on Call. We're taking a final round of your questions, and as always, consult with your physicians about any health concerns. But this is from Vincent. Can a bypass surgery be done robotically?
It is being done.
It is being done. Okay. And talk to me real quick about, we know that in your specialties you're using robotic technologies. What else are they doing?
They're using it for colon surgery. They're using it for thoracic surgery for lung cancer. It's being used for neck surgery or throat cancer. They're using it for some complicated neck surgery, such as thyroid cancer. I believe there are some folks using it for that, but the indications are expanding.
You're right, because we're getting a lot of questions asking about, this question for a brain tumor and nerve damage and those questions. You believe that it's not being done now, but probably will be in the future?
It's possible, yeah.
Yeah, okay. This is Betty. She has a growth of a tumor on her ovary. Can it be removed by a robot?
Absolutely. And the problem is you don't know exactly what you're going to get into, and so it's better to go in with a robot because we can essentially do anything with a robot, and that would be the ideal way to go in.
Okay, because you can go in and you can get right back out if you don't need to, right?
Right.
Yeah, this is Shirley from Sanford. Blood in the urine, seeing a urologist. Mm-hmm. What can she do? How would a robot help her if she fears it's a kidney tumor?
So if she had a kidney tumor, if that was found in her workup, then depending on the tumor, we would, as a treatment option, we would either remove the whole kidney, or more desirably, we would do a robotic procedure. We could remove the kidney robotically, or remove just the tumor and leave the remainder of the normal kidney behind. And that's been an exciting advancement.
Okay. And talk to me about what are the advancements we should expect. I mean, this already sounds like science fiction to me. And we know there probably will be more applications in general surgery, but what else should we expect from the robot itself?
It is. It's like jumping 20 years in the future, and they're coming out with new technology now where they can make tumors turn green and glow so you can see exactly where the tumor is. They're coming out with different instruments that ligate vessels, and every year it's just it's getting better and better.
Okay, we got a question. It's how do you sanitize the robotic arm after different patients?
So the instruments that go into the patient are treated and sterilized just like any other surgical instrument is. The arms that hold the instruments have sterile drapes on them, so there's no contact in that regard.
Okay, and we talked about your field of vision better in a traditional surgery. What about the sense of touch in the traditional surgery versus sitting back basically at a control panel? How is it different?
I'll take it. So, it's something that people were originally concerned with 10 years ago, and it's called haptic sensation. You can't touch something and know if it's hard or soft with the robot. But it's not like you can feel a cancer cell. You can't touch from my 200 pounds, 6 feet tall and figure out where exactly to cut within the millimeter. But what you can do is visualize so much better with the robot. You're really getting better visualization, so you're sort of trading one improved sense for another sense, which really isn't all that important.
They did a survey and asked surgeons, what would you like improved about the robot? And the haptics and sensation was not one of them. I mean, we just haven't missed that at all.
Yeah, okay, and we did get a question, and it is, did the surgeons get carpal tunnel using the robot like that?
And they don't. You're actually a lot more comfortable when you do that surgery. If you start to get uncomfortable, you can hit a clutch and pull back so that you're always in the same position and you don't have the back fatigue and neck fatigue and that you have with standard surgeries.
But there's nothing, because you see, little kids now are getting carpal tunnel because they're playing video games too much, but that's nothing you guys are suffering from?
My typical surgery is about an hour and a half long to 2 hours long,
Okay.
and so there's certainly time in between surgeries to recover. That's not terrible, and you can do a lot of the surgeries now faster robotically than you could have done open, and it's much more ergonomic.
Okay, great. As always, again, consult with your own physician about any health concerns. Thank you guys for answering these questions. And for our phone bank, they're still busy. These are Rex volunteers. They've been taking these phone calls this afternoon. Join us next month when we're going to focus on cooking and healthy eating in a healthier way. Rex has become a hot spot for healthy and delicious cuisine.